Was there a case or a moment that kind of broke the camel's back and made you say, there has to be another way?
My main driver was just seeing such severe mental shifts in these kids to where these parents were in such a fight or flight all the time, living in chaos, and it affects other siblings in the home and the parents. And so finding what was driving that, because it was such a severe change for them.
So how do you define integrative in your work with children? What does that actually look like in the exam room, for example?
So with integrative medicine, the way that I view that is there's always a place for traditional medicine, right? I mean, there's definitely things that we need medicine for. Antibiotics are definitely a part of care that we can need. But for me, when children come in, whether it be a well check or a sick visit or whatever they're coming in for, there are other things to try first. So let's support that gut microbiome. Let's support that immune health.
The nutritional component with when kids are young and they're exposed to all of these things that are really not healthy, and there's hidden sugars and everything too, which sugar is another big inflammatory culprit as well. And there's, that's hidden in so many things too.
You'll hear parents say that this child literally changed overnight. Maybe they were outgoing and extroverted and into sports, and then like the flip of the switch, they just changed.
Welcome to the Root Cause Reset, the podcast where we cut through the noise of symptom chasing and quick fixes and get to the truth about what's really going on in your brain and body. I'm Dr. Trish Schneider, a psychiatric mental health nurse practitioner and functional bloodwork specialist. Let's get started. Welcome back to the Root Cause Reset podcast, the show where we don't slap Band-Aids on chronic chaos. We dig, we decode, and we flip the damn script on what's really keeping us sick, stuck, and spinning. Today's episode is for every parent who's been told your child has anxiety, your child has ADHD, or worse, your child needs to try harder. My guest is someone who doesn't buy that narrative, and neither should you. Melissa Smith is a certified pediatric nurse practitioner and a pediatric mental health specialist. But more than that, she's a clinical rebel with a root cause lens. Her practice, integrative. And her philosophy, kids aren't broken. They're biologically overloaded and emotionally unheard. And what she's about to share might just change how you advocate for your child forever. So grab your coffee, grab your notes, and maybe grab that diagnosis you've been second guessing, because we're about to flip it inside out. So Melissa, my first question is, what made you shift from traditional pediatric care to integrative practice?
First of all, thank you for having me. My shift happened in about 2018 when my mom had cancer. So my mom was diagnosed with cancer and she was working with a naturopath. And so I started to see how just diet alone healed her and healed her gut microbiome. And so what I was seeing in clinical with children was more and more autoimmune conditions, more and more mental health issues. So it brought me down a road to start to think, is there something that we're missing in traditional medicine? Are we covering things up? Are we putting Band-Aids on much bigger issues? And so that started me down this pathway to heal these children, truly heal them, so that they're not on all of this different polypharmacy that they're on and being treated for things that really aren't the right diagnosis for them.
Yeah. Was there a case or a moment that kind of broke the camel's back and made you say, there has to be another way?
There was. So I'll give you a couple examples of children that came in. When they come in to me, their symptoms range from either severe anxiety, aggression, anger, to tics, like motor tics or verbal tics. Some children hallucinate. Some kids just they just kind of scream most of the day, right? They're just a lot of neuroinflammation. And that really was when I started to say, we have to be missing something here, because every child would come in typically on medicines that wasn't helping the situation. And so when I started to look into how the body is trying to manage issues that the brain is dealing with or the gut is dealing with, if I could go in there and help rewire certain things or support things that were missing, I found that these kids do really well. So my main driver was just seeing such severe mental shifts in these kids to where these parents were in such a fight or flight all the time, living in chaos, and it, affects other siblings in the home and the parents. And so finding what was driving that, because it was such a severe change for them.
Interesting. And would you say the biggest symptoms that parents were coming to you with was like behavior dysregulation?
It was for sure. I think that was one of the biggest things that brought them here. So when symptoms start, they can start quickly, they can start kind of gradually, but by the time they reach me, parents have typically gone through the normal traditional route. They've gone to the neurologist, they've gone to the GI doctor, they've gone to the psychiatrist, and they get to me and they said, "Well, everything is normal." They tell me it is, but it's not normal. And so at that point, I kind of sit down with parents and say, there's a lot of factors that can factor into what's going on with your child. Let's sit down and kind of get a full history, talk about birth on, and let's look at those, high risk potential setups that can cause a change in your child. I always tell parents, when a child is born, their bucket is empty, right? And then things along the way fill their bucket, and that can range from vaccines to heavy metal toxins, to toxins in our environment, to you name it. And then they get to a point where that final drop in the bucket tips their bucket, and then you see what you see. So it's years in the making. You'll hear parents say it was like the flip of a switch, like overnight, but really there's a lot more to it. So what I tell them is, we're going to go back and empty their bucket, right? And that way you can truly see symptoms, because right now it's very difficult to tease through what's going on with your child because we haven't looked at the foundation, so to speak.
Absolutely. So how do you define integrative in your work with children? What does that actually look like in the exam room, for example?
So with integrative medicine, the way that I view that is there's always a place for traditional medicine, right? I mean, there's definitely things that we need medicine for. Antibiotics are definitely a part of, care that we can need. But for me, when children come in, whether it be a well check or a sick visit or whatever they're coming in for, there are other things to try first. So let's support that gut microbiome. Let's support that immune health. And then if we have to, I'm not opposed to using pharmaceuticals if they're necessary, because they can be life-saving. And I always tell parents, I'm the first one to tell you, I'll be honest with you, if you need it, then I'm going to be honest and say, I think your child needs this at this time. But I think where we fail in traditional medicine is we don't start there, right? We always kind of start with, oh, you've been sick for 2 days, here's an antibiotic, right? Or, here's a steroid or whatever it is. And really we don't look at, building the foundation, their gut microbiome, to make it super strong and support immune health. So when people do get sick, it's quicker. Their body can clear it quicker, and then they get immunity from those illnesses.
Yeah, absolutely. We treat the symptoms, don't we? Yeah, for sure. And do you do any like do you get blood work on these kids?
So I'm going to give you an example of a PANS child, and PANS is pediatric autoimmune neuropsychiatric syndrome. So you'll hear parents say that this child literally changed overnight. Maybe they were outgoing and extroverted and into sports, and then like the flip of a switch, they just change. And so what I always tell parents is that there's so many factors that can are at play here. And so we're going to kind of go in and we're going to look at the foundation of the home, the gut microbiome. And so there's testing that I do for that. And then there's also testing. I specialize in genetic SNPs. And so those are things that are turned on by the environment. And unfortunately, because our world is as toxic as it is, these are getting turned on more and more. But it's important because it changes the body's ability to detox. So when you start to overload anybody with all of these toxins and they get to a point where their body just can't put out 12 fires anymore, now you have symptoms. And I always say symptoms are the body's way of talking to you. And so if you're having these symptoms, something, right, is kind of not working the way it should work. And so when you dig into the foundation, you get rid of things that shouldn't be there. You support methylation. They do really well. Blood work is important as well to check basic labs, also food allergy sensitivities. It all plays a role in what
Mhm.
you see emotionally in these children. And once you work to clear those things, they do really well.
Wonderful. Absolutely. What are some of the hidden root causes you regularly uncover that most traditional doctors miss?
So the biggest two that I see are fungal overgrowth. So that could be either candida or mold, and also Clostridium, which is a bacteria that lives in our gut. All of this kind of lives in our gut microbiome to a degree. When it when it grows and it takes over and it gets a foothold in the gut microbiome, that's when it becomes a problem. So, for example, fungal overgrowth is a big driver of mood lability because it affects the body's ability to clear excess neurotransmitters, hormones, and things like that. High histamine people typically are very fungal overgrowth people, right? If you're living in a mold situation, these children will, everyone reacts differently, but some kids will have severe mental changes. Also, Clostridium being one of those bacteria that you have to get rid of because it will affect dopamine specifically. So, most of my children have too much dopamine on board, and they present that way with a lot of different symptoms, but they're all pretty much, I mean, they're due to the same thing, right? So you can have, again, very angry children, OCD, very tightly wound people is the best way to describe it. And when you start to get rid of things and empty their bucket, then you start to have kids that their behaviors return to normal. They're not, they're not having these crazy outbursts of anger and all of that that's driven from a gut microbiome problem.
Hmm. So, do you usually start with healing the gut with a child? Yeah.
I do. So there's always kind of an order in which I do things because parents will come in and they'll say, well, it could be so many things, Melissa. It could be heavy metals and parasites and where do we start? And so my answer is always to start with getting rid of colonization. Once you start there, the body's an amazing thing and it really can do the things we want it to do on its own, but it can't do it if it's overwhelmed. So my goal is to go in there and get rid of basically things that shouldn't be there, overgrowth specifically, support methylation, so allow the body to have enough glutathione to detox, and all the things that are being these genetic steps are causing hiccups in the DNA expression, and so to be able to support that, and then once you do that, you see the body start to detox like it should. So then it can get rid of parasites and heavy metals. So I would never, let's say, go try to fix a problem on the second story when the problem's in the basement. You don't want to start with parasites or heavy metals because the gut microbiome isn't strong. So I find that when your gut microbiome is strong, your immune health is strong, and then also your brain health is strong because they're directly connected.
Hmm. And how long is the process when you have a child that needs to go through the prep process, the detox, and then sort of like the, you know, reintroducing, nutrients and probiotics? Is it several months that you're working with the child?
It is. And so I always say it's a marathon, not a sprint. It took them a long time to get to where they are. And I can understand as a parent how frustrating that would be to wait. But I do tell parents it is a process. And so after we do the testing, I put together the perfect plan for them. I don't have protocols that I follow because every child's different.
Mhm.
Everyone's genes are different and everyone has different needs. So based on that testing, we put together that plan. And what I see within the first month or two is changes in the positive direction. So maybe a child who would have temper tantrums that were lasting 30 minutes now last 15, right? So, or they're much quicker to redirect or things. Those are all things I'm looking for. And then as you go through the process, they can flare if they're exposed to certain things. So illness is one of them, heavy metals, things like that. And so there is some kind of, you kind of go up the hill and kind of slide back down a little bit. But it's a longer term process for a goal of them having long-term health. So I would say I work with parents anywhere from like 6 months to a little bit longer to get them in a good place. And then they check in as they need me from that point on.
Do you also work with families on nutrition and sort of changing some of the habits that maybe have contributed to dysbiosis or, the gut microbiome not being the best it could be?
Absolutely. Here's where the challenge comes with kids a little bit, as being a mom too. Our food is not good in this country, and I think most of us know that, right? It's kind of covered in, glyphosate, things like that. So we have issues with our food system. And I tell parents, two of the most inflammatory foods are dairy and gluten. And unfortunately, they're in everything. And I have two children. And so I know that it's easy for me to come in and say, take it all out of your diet, right? That'd be fantastic. But I'm also a parent, and I realize that sometimes, I want the child to be on board with the program too. I don't want them to be so discouraged because I'm taking away everything from them. So I always say even 80-20, right? Everything kind of in moderation is better than nothing, and you're taking out those inflammatory foods, because when you eat foods like that, you fuel more gut inflammation. So depending on what those allergies and sensitivities look like, I might say, hey, take it out for me for a couple months, and then you can reintroduce it. And usually at that point, when they see how they feel off the foods, they're much less likely to reintroduce them anyway. But I kind of work with each individual family, because it is hard as a child to be told you can't eat what are all the fun things kids are eating, which is so
Absolutely.
backwards, you know what I mean? Because it's really not. But they, pizza and ice, all the things. But they find that as they feel better, they don't want to eat those foods anyway, because they just feel better off of them.
Right. Yeah, it is hard to change the nutritional component with when kids are young and they're exposed to, all of these things that are really not healthy. And there's hidden sugars and everything too, which sugar is another big inflammatory, culprit as well. And there's, that's hidden in so many things too. Um, and so how often are you seeing like behavioral symptoms that are actually biological, nutritional, or environmental issues in disguise?
Almost all the time. I mean, I think you can that's whatever diagnosis the kids walk in here with. So it can range from ADHD to anxiety to depression to OCD to ODD to autism. And I always tell parents, that none of those diagnoses are fair till you've done the groundwork. These kids are toxic. I wish there was a diagnosis for toxic, because that's what they are. And it can be toxic from food or the environment or anything. And if they're not detoxing properly, they show with symptoms of mental health. Kids primarily, in my opinion, show more with mental health symptoms as a sign of toxicity, whereas adults have more, it's not quite so obvious with mental health necessarily. It's more like they're more fatigued or autoimmune conditions, or like, that kind, just poor health in general. But kiddos, when they have severe behavior shifts, there's always something that's at the root cause of that. And once you help to support that, and especially to support methylation is a really key part of all of that, then they start to feel better. And after that, when you see that, now you can it's like lifting the fog up and saying, okay, now I can see my child. Are they still having these symptoms? And 9 times out of 10, they're not. They're much better. But even, I have children that come in with ADHD diagnosis all the time, and it's not the right diagnosis because they have too much dopamine on board. So they come in on stimulants and they're angry and they're really, really mad. And it's because they've just pushed them even higher, right? So my goal for mental health for children is to make sure that they can, this young demographic, and they have their whole life ahead of them. And some of these diagnoses stick with them forever. So I want to make sure that we kind of see the full picture before you diagnose any child with that. I've had children come in with autism diagnosis that were not autism. And you could tell because we did the testing and got them on a protocol, and their speech was fine. And their eye, everything that they present with autism symptoms resolve based just on that, which is so rewarding and incredible. But most of these kids are just toxic.
Yeah, absolutely. If you could scream one truth from the rooftops to pediatricians nationwide, what would it be?
I would say think outside the box. I think we're very much, they're kind of stuck in the way. And I mean, I was like that for a while till my eyes got opened. But, if you can take one thing to take into consideration, be like vaccines, for example, right? I think we need to look at where we are now in our world with vaccines. We don't live in the same world I grew up in. We don't live in the same world that my grandparents grew up in. And so it's a much more toxic world, and it is not a one size fits all. So when you start to, tell parents, this is the way we do it, this is the way we've always done it, it's safe, it's effective, And they're not looking at the research. They're not looking at the fact that these kids aren't methylating. They're not looking at any other symptoms other than it's worked before, it worked now. Is not a fair. It's not a good way to do medicine. They really have to keep up to date on research and look at the bigger picture.
No, it's true. And traditional medicine really, we're treating symptoms. I mean, really, when we look at mental health, and we diagnose, and the treatment is medication and therapy. I mean, what else is there? Even nutrition. I remember, like, I'm thinking back to nursing school. Did I even have a course in nutrition? If I did, it was minor, and it was only one. And if it was a course on nutrition, it was something like, this is what you would want for a cardiac patient. This is what you would have for a dialysis patient. It wasn't like nutrition is medicine, where you want to have, more plant-based foods in order to, provide, the best nutrients. My gut microbiome, like, I didn't hear that at all in nursing school. So, and I get a lot of that too from, patients, from adults that say to me, I went to my primary care physician, I had my physical, they did labs, and everything came back normal, and I still feel like crap,
Yep.
you know? And it's true, because when we're memorizing labs, like, what do we really do? We're memorizing numbers, and if as long as it doesn't, get flagged, either or, if it's within that range, you're good to go. But it's not optimal. And look at vitamin D. I'm like, oh my gosh, it could be like anywhere from like 20 or 30 to 100. Like, that's crazy. Like, we
Yeah.
really want it to be between 50 and 80. So,
Yes.
like, what have we been doing all these years? We haven't really we haven't done that. So when they say to me, well, how come my doctor never talked about this stuff? And I tell them it's not their fault. They just don't know, because they don't teach you this in medical school, in nursing school. Like, we didn't talk about any of this stuff. It's like, here's the lab, memorize these, this physicians are going to use it to diagnose and to dictate what the treatment's going to be. And that's it. Not like, use this as medicine, and let's do everything possible to create that healthy microbiome so we can prevent disease from happening, and we possibly don't ever need to be on medication. And the brain fog, oh, maybe that is like due to toxicity or exposure to some, it's just, we have to definitely shift the way of thinking, right? Because we're just chasing symptoms, and we're not really looking deep into what is the cause. Because if we did, we'd be in a much better place. Because for a country that spends a lot of money on healthcare, we are really at the bottom for how healthy we are as a nation. So we're not doing things correctly, right? It really
Absolutely.
makes you wonder. And I know the food has a lot to do with it. For sure. I lived in Italy many years ago. My husband took a position there, and I moved there. And I remember thinking at the time, I would look at um, ingredients, and I would look at labels. And then I realized, I'm like, wow, how come all of these chemicals are banned in Europe, but they're readily available in the United States? I'm like, that's something, isn't that something? And then I was like, started to really get into like looking at labels and nutrition and all of these things. And it was just shocking and eye-opening. I'm like, what really is in our food that other countries are banning it? So it really is, yeah, it's a culmination of factors for sure.
Absolutely. I agree with that 100%.
Yeah. So let's talk about misdiagnosis, since you mentioned that. What conditions do you think are overlabeled, and what causes get totally ignored as a result?
So I would say most of the mental health issues are very misdiagnosed. So, for example, ADHD, that's a big one that I see a lot of kids being diagnosed with. And
Yeah.
ADHD, honestly, is due to too low of dopamine. But if you look at these kids, 99.9% of them that come in the clinic here have too much on board. So that's it. They look the same. They look the same at both ends of the spectrum. So they're going to look like they can't focus or sit still when their dopamine is too high or too low. And so that one I see misdiagnosed a lot. And also things like, anxiety, depression, normal things like that, very much misdiagnosed. Because again, when your body can't detox or can't function properly, it's your brain's going to suffer. You're going to have all of these, you're going to have more mental health issues. They did a study, it was very interesting, on the elderly, and they found when they did the study that over half of them were incorrectly diagnosed with dementia and Alzheimer's. They actually had mold exposure. So mold is a big problem that I see, and it can range in how it presents with people. You have 5 people living in the same house and 3 people have symptoms and 2 people don't. And the question I always get asked is, why is that? And it's opportunity. Those people where it is a symptom have had more exposure to different things, or things came together at the right time and it changed them. And so mold is always, always, always in the back of my mind. And I think as traditional medicine doctors should be thinking about that as well, because it affects the thyroid, it affects the HPA axis, it affects everything. And I always kind of joke that every symptom you can possibly think of can be mold. Numbness and tingling, confusion. I mean, it's just, you name it, right? So I think any mental health, anything should always be looked at further and dug into and said, okay, is the body working the way it should work, right? Is the gut microbiome strong? Are we, detoxing toxins properly? Are we methylating properly? And then after you do all of that, then you see that the body does start to really do well. So I think a large part of what I see is misdiagnosis. And the scary thing, I mean, even autism is another one that, very much a real diagnosis, but what's happening more and more that I see now is that kids are getting lumped into that category because they don't know what to call it, right? They're like, I don't know, you fit some of this, you fit this diagnosis, so, we're going to put you, well, that follows them their whole life. And so to me, it's not fair. I mean, you can't make that diagnosis because you haven't done anything to support their health. And so once you do, those symptoms go away and they improve drastically, and then they don't have the same symptoms. So to me, it's most everything. I always kind of look skeptical with diagnosis with anything. I mean, even thyroid stuff. I mean, thyroid stuff can also be mold. So there's just a lot to say what's causing all of it, but I'm kind of skeptical with pretty much any diagnosis
Yeah.
now. So
The thyroid gets blamed for a lot of things too.
it
Yeah,
does.
that's another
Yes.
one. That's another big one that I tend to see is that it's the thyroid, and
Yes.
it's your gut.
Right. 100%.
No, it's not your thyroid, it's your gut.
That's right. That's
Um,
right. Yep.
so what does your process look like when a new kiddo walks in your office with anxiety, ADHD, or mood issues?
So the first appointment is a very in-depth going back from birth on, because as I explained to parents, it starts at birth, right? Which way were you born? Were you a C-section or vaginal? It's going to set your gut microbiome up. And then we talk about current symptoms. So however they present. So a lot of them will have anxiety, but we talk about, do they have allergens? How is their sleep? How is their diet? And then we, from there, kind of come up with a plan of what testing would benefit them. And most all of them need to have gut microbiome testing. And then the other component being that genetic SNP testing that's important. And I kind of explained to parents, most people know about MTHFR. That's kind of the big buzzword that a lot of people have heard about. But there's a lot in that cycle that get forgotten. And you can overmethylate a child or anybody very easily. And that is not something that parents want me to do, because that's a very angry child. And so I always say, until you look under someone's hood, you really shouldn't be supplementing things. So that's the process. And then at the next follow-up, I literally walk them through every one of those markers, because as a parent, I can't possibly imagine the fear to see your child change. You're losing your child. They're different. And I heard it, time and time again, give me my child back. And then when you explain to them what the body's doing and how the body's trying to correct things and what you're going to do to help that, it's very empowering for parents to understand that. I want them to know why their child's taking a supplement. Like, what is it doing in the body? And then from that point, we kind of do frequent follow-ups to kind of see how we're progressing. And then it may change to, detoxing, fungal overgrowth, and then maybe, bacterial. It kind of changes. But the first appointment and second appointment are very long appointments to basically get a full history and then, dig deeper into that functional medicine testing and explain as to why. I had a parent that came in with literally 20 supplements, and she's like, I don't know, we're just on these. I have no idea, but we're on them. And I'm like, well, that's not good. So, now with I want them to understand why they're taking what their child's taking what they're taking.
Absolutely. Yeah, absolutely. Can you walk us through a real case without, of course, naming names where root cause work changed the entire trajectory for a child?
Absolutely. So I had a child who came in. She was about 7, and she had had a very sudden change in her behavior to where she was a very happy kid, a very easygoing child, to she was hitting her siblings. She was hitting and biting her mom. She was very aggressive. And then she was also having a lot of sensitivity to texture. So specifically clothes. So she couldn't wear socks. She didn't want her hair brushed. There was a lot of things that they were struggling with. She had to wear the same clothes over and over again. So when we did our testing, we kind of dug into the gut microbiome and noticed that one of the things that's a big thing I'm seeing as tied to like hypersensitivity can be both mold and Clostridium. And she had a very big Clostridium problem. We treated that. And within about 2 months, she came back wearing a brand new pair of socks, right? Her mom could brush her hair for the first time in a year. So these are all really, really big wins. And they don't seem like they are. But if you look at that, it's due to something that was in the gut microbiome. That's but scary. And I totally understand as a parent, that'd be terrifying. Your child doesn't want to wear socks. Why don't you want to wear socks? And frustrating. But
Yeah.
it comes from something that shouldn't be there. So when you correct that, I've heard it, you gave me my kid back, right? She's more grounded now. She's back to where she was before.
Amazing. Yeah, that's amazing. Oh, I love that. What tools or modalities do you lean on outside of medications?
So supplements, very much supplements, and supplements being, again, whatever that testing is showing me that their body needs. B vitamins and, mitochondrial support and all the things that the body may be lacking. And so based on whatever the testing shows, it may start with a bunch of supplements, but those change over time as the body starts to detox properly. So definitely supplements. Also, of course, nutrition and sleep, right? Diet and sleep and getting out and being in the sun. I think we don't do a good job of that. We don't realize how much the sun plays a role in insulin resistance and all of the things that also contribute to poor health. And so getting outside, just sitting in the sun for 15 minutes, right? Waking up with the sun, all the things that I don't think we do a very good job of, because we're busy in our life and we just don't think about these things. So trying to incorporate all of that into the plan of
Mhm.
care to better help their health.
Do you have conversations with them about screen time as well when they can't sleep? And then you
Yeah.
ask them about how
Yes.
much screen time they're using, and then they're like, all the
Yes.
time?
Yes. And that's a tricky one because, our world is on screens. I mean, they're on screens at school, they're on screens all the time. And it's interesting because a lot of my kids that are super hypersensitive to screen time tend to have mold too. And so it's one of those things where I try to say if you're going to be on a screen at nighttime, wear blue blocker glasses or at least take it out of your room at night, right? Because you want to mimic the sun going down. And so insomnia, which a lot of my kids have, is due to too much blue light, right? And so we kind of don't look at that and we don't think about it. And then they leave it in the room and they have it goes off all night long and their sleep is interrupted. So making sure to have conversations about like, this is really great, good sleep hygiene. But also it's interesting because fungal overgrowth can also interrupt sleep because it affects the serotonin melatonin pathway. So these kids don't make enough melatonin. So again, it's like a twofold problem. So having discussions, especially with teens, about what's good sleep hygiene. You take the phone out of the room, right? Get off the phone at least an hour before you go to bed. Wear blue blocker glasses. Keep the lights down when you're inside
Yeah,
and mimic that sun.
sure. For parents who are listening who feel like no one's taking their child's symptoms seriously, what's their first move?
I would definitely say find a practitioner that would take a deeper look into what the root cause could be. I think the biggest hesitation that I see with parents is that it's a different modality. So they're very used to traditional medicine. So they'll go to all of the traditional medicine people, neurology, GI, everybody, and they get dismissed. And then by the time they get to me, they're kind of like, okay, I need something different. I need you to help me, right? So I think finding a practitioner that they feel comfortable with and somebody who um, who will listen to them, I guess, and be an advocate for their child. That's the biggest thing because most of these parents feel very dismissed. And again, as a parent, it would devastate me to because I know my child better than anybody knows my child. So, nothing is more frustrating than having someone tell you there's something wrong with your child when clearly, you're at home and there's something different. So finding a practitioner who just works well with you and your family and is an advocate for your child and for you as well.
Yeah, absolutely. That's so important because, I'll never forget, my own like primary care physician who's traditional. I suffered from migraines for years. I had two sinus surgeries. I went to see an allergist. I did all the things and I was like still suffering. And he said, have you tried a chiropractor? And I was like so taken aback by the question. I was like, really? And he said, why not? Go ahead. What do you have to lose? And I was like, so like, oh my gosh. All right. Yeah. And I went for it and it was so amazing. I went and I've been doing it for years and it totally like decreased the number of migraines that I have, like pretty much down to nothing. And had he said something like, "That's ridiculous. That's not even real medicine, blah, blah, blah," I wouldn't have even pursued that. And I would have just continued to suffer with migraines and headaches and all of that. And I see that happen to so many people where I think more traditional practitioners should be in the habit of, if I can't help you and you're still continuing to have symptoms, of course, seek something else. You never know what will work for one person may not work for another. But if that's something that you want to do, because if a patient believes in something, if they believe they're going to get better, they're going to get better. But if you're like already dismissing it as something that's totally ridiculous, then you've also taken away hope. And if you take away hope, then what really do they have? They have
That's right.
nothing. So absolutely, they need to find a practitioner that, supports them and encourages them to go and find somebody that, can help them if even if it's not you. If it's not you, then there's somebody out there that, can help you. Just don't give up. You just have to find that person. So
That's right. That's right.
absolutely. So what are one or two things that parents can start doing at home today to support mental health holistically?
So I think the first thing would most definitely be just dietary support. I think digging into kids' diets, making sure that they're eating foods that are better choices. I think our traditional foods, if you can, I was kind of a joke that if you avoid the inside of the grocery store instead of the outside, you're making good choices, right? So maybe veering more away from packaged foods, eating foods more in their real form, trying to eat more meats that are kind of, grass fed or from the farm. Those all make, because what we put in our body obviously makes a huge difference with how our body works. And I have a lot of kids that deal with a lot of chronic constipation. And so we talk about how it's really super important that you're drinking enough and eating enough and getting enough sleep. That's another big thing. I think kids are very lacking in sleep because they're always on a screen. So I see a lot of kids that are on screens late at night, video games, things like that, don't get the right amount of sleep. And then they suffer with that too because they're not eating well, they're not sleeping well. And then just basic, supplements. I mean, a good multivitamin, right? Probiotics are great. I think you have to be a little careful with probiotics because sometimes if you have a very big dysbiosis in your gut microbiome, you can have like a SIBO type setup. And if you do probiotics, you can make people worse. So again, finding a practitioner who can kind of help guide you with some supplementation, because all of us need supplements, to give you some basic support and especially supporting the gut microbiome. So those are things parents can start right off the bat, just making sure they're staying on top of those things.
Mhm. Do you ever talk to families about addressing their environment, such as checking for mold or air purifiers or even like water filtration systems, for example?
For sure. We talk about that. Mold is a tricky one because it's a it's a very big rabbit
It
hole
is.
and
Yeah.
it's an expensive rabbit hole.
Yeah.
So a lot of times if I find mold markers on testing that I do, then I may say, hey, check your home. And by that, finding someone who's experienced and knowledgeable. There's a lot of people that will do mold testing that probably shouldn't or don't have enough information to know how to look for it. So finding people that are reputable that will do a good ERMI test and check your environment. But of course, air filters are important. Reverse osmosis is important too, as far as your water source, because unfortunately in our water, there's all types of toxins as well. So there's definitely things that parents can do in their home environment to make it less toxic. And I always tell them, you can't put her in a bubble, right? Him or her in a bubble,
Hmm.
but you can absolutely make sure that the body is at its best working place so that it can detox those toxins and then taking out the big ones that you can in your own environment that they're in most of the time.
Great. And where can people connect with your work, your clinic, or your resources?
So my clinic's name is New View Integrative Pediatrics, and we have a website. And you can always reach out to me with questions. If I can't help you, I can guide you to someone who can. We have a website, and then we also have, of course, you can call us in person, and there's a email address as well.
Perfect. And is there any last words you want to share with us or the audience?
Just that if you are dealing with any of this with your children and you feel like there's no one that will listen or help you, that there are people that will. And I would love it if you reach out to me and I can guide you someplace just to know there are people that listen and can help this and that you're not in this alone and that these kids do get better. It's not a forever thing.
Thank you very much, Melissa. It was a pleasure having you, and it was very, very informative.
Thank you so much
So,
for having me. I so
yeah,
enjoyed it.
absolutely. So, if your gut says your child needs more than a label, more than a pill, and more than a 10-minute fix, trust that instinct. Practitioners like Melissa don't just treat kids, they listen to them. And in a world that's noisy, that's radical medicine. See you in the next episode. I'm Dr. Trish Schneider, a psychiatric mental health nurse practitioner and functional bloodwork specialist.